From Bloomberg QuickTake, I'm Madison Mills, joined today by Dr. Anthony Fauci, the nation's foremost infectious disease expert, who perhaps would rather be a bit less famous than he is right about now. Dr. Fauci, thank you so much for making the time to join us today. Just to kick us off, how are you doing? How are you holding up?
I'm fine. This is obviously a very intense time for the entire world and our country, and that certainly gets reflected on what we have to do, our responsibility. It's very intense, but it's something we just have to do. We can't walk away from it. It's a tough situation.
And I want to dive right in because we don't have a ton of time together. Dr. Fauci, if you could wave a magic wand and have three major changes happen in the US, whether that was universal testing or more contact tracing, better healthcare, what would those three changes be?
Well, it probably would be one change that maybe has multiple elements to it. I would like to see a uniform pulling together in the country to both appreciate the need for and implement the things that we need to do to get that baseline level of community spread way, way down. One of the problems that we've had is that if you look at the curves that have gone up and was driven early on by the Northeast, particularly the New York metropolitan area, and then they started to come down. But as they were coming down and getting down to quite a very low baseline, which is good, there were other states in other regions, particularly in the South, who, as they tried to open up and get the economy back, did it in a way that was not uniform. It was a bit disjointed. Some did it well, some didn't do it so well. Some tried to do it well, but the people didn't listen to the kinds of guidelines that were put forth. And then we had that increase that went up from an already high baseline of 20,000 cases a day up gradually to, at one point, over 70,000 cases per day, getting the deaths back over 1,000 a day. We've come back down now to 40 or 50,000 cases a day, which is still extraordinarily high as a baseline. So I would have liked to have seen the kinds of uniform pulling together as a nation. We live in a big country, a beautiful country, a wonderful country that's very heterogeneous in so many ways. But here's a time when you really have to be pulling together as one. So when you're talking about the things you need to do to prevent the surges of infection, as well as to blunt the surges that have already occurred, it's those kind of 5 or 6 things, uniform wearing of masks, keeping distance 6 feet or more, avoiding crowds, being in a situation where you are, washing hands as frequently as you possibly can, and outdoor things always better than indoor things. If we all did that in a uniform way, we would prevent these surges that we're seeing. And it's unfortunate because once you have one go down, then all of a sudden another one comes up. I mean, the southern states that were surging are turning around, doing the kinds of things like Arizona, which are really making a difference. And as that's happening, there are other states, sometimes in the yellow zone, that are starting to tick up. And I just hope we don't see that kind of surging go up. Otherwise, it's going to be bumpy up and down instead of a clear cut down to a baseline that would be very manageable. But we're not there yet.
And Dr. Fauci, you mentioned cases in the South. Would it be worthwhile for some of these red states that you mentioned to go back into lockdown?
Yeah. I'm not so sure you really need to go to lockdown. I mean, obviously, that's always on the table for consideration. But I would think you don't need to do that for so many reasons, because we do know when you implement the 5 or so things that I just mentioned, that you do see very tangible results of the curves turning around and coming down and the prevention of those coming up. So, I mean, a lockdown, obviously, with all the psychological and morale destruction that would do, it would be tough. I mean, you never want to rule anything out that you might have to do. But I'm fairly convinced that we could get to where we want to be without doing that if everyone, as I said in answer to your first question, Madison, if everybody pulled together and were doing things in a uniform, consistent way and abiding by the guidelines for opening the country. I mean, I've said this many times, and I welcome saying it again, that we could use good public health practices as a vehicle, a gateway, a facilitating the opening up of the economy and opening up of the country. Some people look upon that as an obstacle to opening up the country. It doesn't have to be an obstacle. If done in a prudent, careful way, it could help us to open up the country.
Dr. Fauci, one of those 5 to 6 recommendations you speak about a lot is, of course, mask wearing. We know that if we had a universal compliance with wearing masks, that our numbers would be better. So have you considered pushing the president to invoke a federal mask mandate?
Well, I don't think that's going to occur, Madison, because, you know, there's a reluctance to have federal mandates for so many reasons. You know, would it have people actually push back against it? How do you enforce it? I mean, I, as a public health person and as a physician and a scientist, would strongly, strongly encourage people anywhere and everywhere in our country to understand the importance of mask wearing, social distancing, avoiding crowds, the kinds of things that I mentioned. It's critical. It's not something that's going to prevent us from ultimately opening to the fullest. It's going to get us there.
You talk about potential pushback to one of these, a federal mandate of mask wearing, but there are other things that we do enforce federally every day. So why would mask wearing be different?
You know, Madison, I'm telling you, it isn't like I don't think we should do it. I'm just telling you it's not going to happen. I mean, that's
Sure.
the point. I mean, we could talk back and forth about all the advantages or what have you for it. I just don't think it's going to happen.
Fair enough. I'm wondering also if we can talk a bit about testing. Admiral Brett Giroir has said that if we do too much testing, it could overwhelm the system, potentially cause schools to question reopening. Where do you stand on that?
Well, you know, I think people need to understand that there's two types of testing. What Admiral Giroir was talking about overwhelming the system was the testing that is done in response to trying to do identification, isolation, contact tracing. That there's testing that needs to be done according to the kinds of guidelines and plan that one puts forth about how you address cases. Then there's another kind of testing that's surveillance testing, where people want to find out in a given area, be that a region, a state, a county, or even a factory or a school or what have you. That kind of surveillance testing, if that's done in a way that doesn't compete with the day-by-day necessary testing that you need to do to definitively identify someone who's infected, as opposed to surveillance to kind of get a feel for what the penetrance is. If we could do a lot of surveillance testing without interfering with any of the other testing, I'm all for that. Madison, I've been for that from the beginning, of being able to do that quick, easy testing that is scalable without interfering with the identification, isolation, contact tracing type of testing that you do. You don't want one system to overwhelm the other.
And let's talk a bit about vaccines. You've mentioned that we can expect a potential vaccine by 2021. I'm wondering what life will look like when we do have that vaccine. Will we be ripping our masks off and running back to the office? What will day-to-day life look like?
That's a good question, and it's going to depend very much on what the percent or level of efficacy of the vaccine is. I mean, if, you know, very few, there aren't any vaccines that are 100% protective. The really, really amazingly good vaccines are vaccines like measles, which is 97 to 98% effective, which means once you get that, you'd get immediately a degree of herd immunity that the entire community will be protected. We don't know what the level of efficacy is going to be. We hope it's going to be somewhere around 70, 75%. I mean, I'll take 97% any day of the year. I'm not so sure we're going to get there. I would be very happy with 70, 75%, and I would be accepting of 50 to 60%, because that would be value added, superimposed upon, and complementary to public health measures. So if we don't get a vaccine that is highly, highly, highly effective, even though it would still be a good vaccine, I think we would have to have some degree of attention to public health measures. I don't think it's going to be, we have a vaccine in 2021, forget it. You can do everything you want to do. You don't have to worry about any of the public health recommendations. I don't think it's going to be that way. I think ultimately we will get to that, but I don't think it's going to be as soon as the vaccine comes, because it's going to take a while to build up a cumulative amount of immunity, either induced by the vaccine or by natural infection, to get to the point where you really have a veil of protection or an umbrella of protection over the community. That's not going to happen in the first couple of months of availability of vaccine. So we will not be able, I hope we don't, we should not abandon public health measures even when we do get a vaccine.
You talk about being happy with 50 to 70% effectiveness with the vaccine. Can we just go back to the science of what that means for our audience? Can you explain what you mean by those numbers?
Yeah, that means that, when you compare the persons who are vaccinated versus not, the protection is 50% of that would be. In other words, 50% more than if you didn't get any at all.
Sure.
The easiest way to understand, if you get 100% protection, everybody's protected. Okay, that's what it means. I mean, that's simple as that. But we're not going to get there. We're going to be like 50% of the people, or 70% of the people will be protected.
And we got a lot of audience questions in advance of this interview about the potential Russia vaccine. Putin is pushing ahead of regulators on it. If that vaccine doesn't go very well, how could that impact overall trustworthiness in vaccines more globally?
Well, that's a very good question. That's why I'm quite disturbed by Russia or any country which declares they have a vaccine before they've adequately tested it, because that would really impart upon, I guess, the rest of the world, if it turns out that the vaccine isn't safe. I mean, there are two things about a vaccine you want. You want it to be safe, and you want it to be effective. Now, if you get a vaccine that you make and you decide you're going to distribute it before you have shown that it is safe and before you've shown that it's effective, that there are two aspects of that are really problematic. One, if it's not safe, you're really in trouble, because you're going to be giving it to hundreds of millions of people, and there's possibility that you'll harm them. And then if it's not effective, you get people thinking they're protected and they're not, which would modify their behavior. So that's why I'm very, very concerned when you hear about a vaccine being developed, but then being distributed without having adequately tested it, which is the reason why of the vaccine candidates that are being tested in our country and in several other countries, that there is a very, very strong emphasis placed on proving that it is safe and proving that it's effective before you make a decision to widely distribute it. Because with vaccines, unlike drugs, which you're giving to a person who may be sick, who needs the drug, you're distributing vaccines globally to billions of people who are healthy people, or people who you don't want to make sick with the vaccine. That's why we emphasize safety very strongly.
And you've already started a community information effort around the vaccine trials. And as you mentioned, that there is some concern about vaccines, particularly in the US. So what is your plan for sort of rallying people behind supporting a vaccine once it's developed?
Well, well, that's a good question, Madison, but there are two aspects of that. First of all, you want to make sure that in the testing of the vaccine, before it is approved to be safe and effective, you want to get an equitable type of a distribution representative of your society. You don't want to test it in one demographic group and then assume that it's safe and effective in another demographic group. It likely will be, but you'd like to see good representation of people of different ages, different sexes, and different race and ethnic backgrounds. That's what you want to do, because once you prove that it is safe and effective in a representative group of people in the country, when you want to distribute it after it's been approved to be safe and effective, you can say that I've adequately tested it representatively in each of these groups. Once you do that, then you've got to have what you alluded to a moment ago. is community engagement and community outreach, to be very transparent about the results of the trial and to try and convince people to understand why it's important for them and important for society for them to get vaccinated. And particularly in situations where you have minority groups, African Americans, Latinx, and others, particularly the African Americans who historically have not been treated well by the medical and public health community. If you look at things like Tuskegee and incidences like that, we've got to make sure that they understand that this has been very, very carefully tested. And we're doing it because we want to protect the entire nation, not just one group versus the other.
And you bring up a great point about reaching out to minority communities. We know that COVID-19 is disproportionately impacting Black Americans. What can be done to specifically address that health disparity?
Well, I mean, there are things that one can do immediately, and there are things that are so deeply ingrained in society that it's going to take a commitment over decades to do. So if you look at the African American, Latinx, and even other minority communities, by the very nature of the kinds of jobs as a group they generally have, you don't like to generalize, but in this case, it's appropriate to, that African Americans and Latinx often don't have the capability of having a job where they can be safe so that they can separate themselves physically. They're often in those on the line, in the trenches jobs that puts them in contact, which on the one hand, puts them at an increased risk of getting infected in the first place. Once they get infected, then you have the situation, because of many of the social determinants of health over decades and decades, they have a higher incidence of the comorbidities or the other diseases which put them at greater risk of having a poor outcome of infection. And those are things like diabetes, hypertension, obesity, chronic kidney disease, chronic lung disease. The incidence and prevalence of those comorbidities in the minority populations is greater than the general population. So I always say they have a double whammy negative against them. Something you can do now for that is you can make sure that in those areas, be they counties, cities, regions, states, where you have a demographic overrepresentation of minorities, that you have facilities of testing to be done rapidly and carefully so that they can enter into healthcare if they need it as quickly as possible. So you want a concentration of those resources now. In the long run, how you overcome those kinds of factors that have led to the increase in a variety of comorbidities is going to take a commitment that really, looking forward decades, because it took decades to get there. You want to take a commitment of decades to get out of it.
You mentioned the impact of COVID on folks with specific jobs, and that makes me think of teachers and schools reopening. I'm wondering how confident you are that schools in what you call green zones will be able to remain open, and how worried are you about school reopenings causing outbreaks?
Well, again, I think you just ticked off the first part of that, Madison. That is the thing that is sometimes confusing to people, in that you can't look at this country when you're talking about schools, and we're talking about elementary, middle, and high school. Universities are a different story. You can't look at it in a unidimensional way, because we have a big country that differs considerably in the level of infection in different regions, states, cities, counties. So if you are in a green zone, you can't just say, okay, we're safer in a green zone, forget everything. You've still got to have the kinds of precautions, but you can open up the schools relatively easily when you're in an area where there are very, very few infections. It gets a little bit more tricky when you get into the yellow zone, namely one in which you have a 5 to 10% test positivity and a 10 to 100 per 100,000 cases, that you need to take a look at the school and at the local level to make the decision based a lot on the CDC recommendations about what can you do to mitigate the possibility and the chance of infection and of spreading of infection. That could be hybrid, where you do some online, some in person. You can have part outdoor classes. You can alternate days, morning, afternoon. I don't want to prescribe that now, but locally, there are some creative ways of doing that. But when you're in a hot red zone, you really better be careful before you just throw children back, even though the principle and the default position, which I've always said should be that you should try as best as you possibly can to get children back to school for the reasons we're very familiar with, that the American Academy of Pediatrics has articulated, because of the mental and psychological health of the children, because of the fact that some children rely on school for nutrition, for breakfast and for lunch, as well as the downstream negative effects on families who may have to modify severely their work schedule to be able to take care of the children. So you should try to do that. But underlying that, and the however and the but about that, is that you absolutely need to pay attention to the health, the welfare, and the safety of the children, of the teachers, and the people associated with them. So you can't make a decision for the country as a whole. You've got to look at where you are in the context of the level of infection that you're dealing with.
And Trump's new coronavirus advisor, Dr. Scott Atlas, has been a big proponent of returning to schools. Have you spoken with him?
Well, I have had brief conversations with him. I'm actually going to have a somewhat extended conversation with him later on today to try and get a feel for where we are with regard to these issues, and do we differ, and if so, how much? I'm looking forward to that conversation.
What's your main goal for that conversation? You touched on it briefly, but do you have any other goals coming out of that?
No, what I would like to see is actually, you hear a lot about what people are saying, about what they think and what they feel. I'm of the bent, I've always been, to just go right to the source and have an open, honest conversation about how you feel about certain issues, what your recommendations might be, and I'll tell you what mine are. Hopefully we can come to some sort of, agreement, if you want to call it that. We'll see. I mean, I'm just leaving a completely open mind in my discussion with him.
And I'm also curious, when was the last time you were able to speak with President Trump about COVID?
It was a few days ago, last week, I believe it was. I briefed him about vaccines. With this time, it wasn't a long time ago. It was within a week or so. I would say probably within a week.
And I have a few more vaccine-related questions for you, Dr. Fauci, before we let you go here. How soon can we expect preliminary results on the NIH Moderna vaccine?
You can't expect. It may occur.
If that's the main lesson we've learned in this pandemic, you can't expect anything, right?
No, actually, I'll explain. It's a process that's a time-honored process. Whenever you have a vaccine trial, in any trial, not only Moderna, but all the trials, you establish what's called an independent data and safety monitoring board, referred to as a DSMB. And it's an independent group of statisticians, scientists, community people. What they do is that they independently look at the data on an intermittent basis, and they can determine, and they're independent and they make the recommendations. Either the trial is going fine, continue it. It doesn't look like you're going to get an answer. It's futile. You better stop it. Things are so bad, you better stop it. Or things are so good that you should stop it now because the results are so favorable. And they look at it every, periodically, every month or two or what have you, sometimes even more frequently. And then when they come to that determination, usually the determination is things are going well, continue the trial. That's what you almost certainly are going to get from the first determination that the DSMB looks at. But that's very standard procedure with all these vaccine trials.
And similarly, how close are we to having a strain that would enable human challenge trials, and how could that help us get closer to a vaccine?
Yeah. I think there's a misperception that human challenge trials with SARS coronavirus 2 is going to get us to the end point where we want to be sooner. You're not going to get the strain in a shape that's, what's called good manufacturing practices that the FDA would even allow you to put into someone probably for several months, which means that hopefully we'll have an answer from the trials itself that you wouldn't even have to revert to a human challenge study. I would say when people ask me, and I mean that, given all the potential difficulties, because we don't yet have adequate therapies for that, we still don't know the full scope of the disease and what the chronic long-term effects are, we're very reluctant to do that unless it's absolutely essential. So that's not even my plan B. To me, that's plan C or plan D.
And more broadly, what does success look like for you and for the country? How will we know that we have the virus under control? And in places like New York or other states that have started to get it under control a bit more, will we see a resurgence in the fall potentially?
Well, I mean, that's what we're trying to avoid. And the easiest way to avoid it, getting back to what I said during the beginning of the interview, Madison, is to get down to as low a baseline as possible, so that the percent positive of the test you do is like 1% or less, at the most 2. And that, like, you don't want to go into the fall where parts of the country have a percent positive in double digits. That means that the virus is still around and around in full force. And then if you get into a winter where you have people spending more time indoors, more difficult to control the spread of a respiratory-borne illness, that could be a problem. So we have a window of opportunity now. And that's the thing I keep saying. Let's jump all over that window now to be able to, as a nation, to pull together in a consistent, prudent way to control this at the same time as we're carefully and prudently trying to open up the economy and open up the country.
And you've shared a lot of your recommendations with us today. I'm wondering, when your recommendations are at odds with the president, how do you navigate that discussion? How do you decide what to share with the American people? And can you kind of take us into what those discussions look like?
No, actually not, because, when you have a personal one-on-one discussion with the president, it's just not a good idea to then go out and tell everybody what it was. You'll hear from me very clearly and firmly what my recommendations are. And then, obviously, you'll be hearing from other people. Hopefully, we're all on the same tune and the same page, so there won't be any confusion.
And moving on to the election, I'm wondering, you've spoken about how voting in person is potentially similar to going to the grocery store. But is there any upside to encouraging mail-in voting just to avoid any and all risk?
There should be both in my mind. I was asked about, mail-in voting is a policy issue. In-person voting, people ask the public health aspects of that. When I use the example, when you try to go to a grocery store or to a Starbucks, you see the X's on the floor. Stay here and don't move until that X is empty. That's good. That's what people are doing. I think if you have mask wearing and you have a situation where people in the polls are also being careful, hand sanitizers, I think you could safely vote in person. I also think for people who can't do that for one reason or other, who are concerned about doing that, they should be able to vote by mail.
Dr. Fauci, we only have a couple minutes left with you. So 2 quick fun questions for you. You've been very heavily embraced by Gen Z and the internet and turned into a lot of very fun memes. I'm wondering, did you ever expect to be so beloved by the under 18 community in the US?
No, I didn't expect to be so loved by the under 18 community. I also didn't expect to be so hated by other elements in society. Which just proves the divisiveness which we have. I try not to pay attention or get distracted by either extreme and just focus on the job that I'm supposed to be doing.
Absolutely. And I wonder how some of that negativity is impacting you. Are you able to take care of your mental health at all during this, or is your entire life dedicated to your work right now?
Oh, it's 110% dedicated to my work. My mental health is fine. I have a wonderful wife and family who are very supportive. I got really good friends that are supportive. So I'm fine. Obviously, I'm like everybody else. I'm exhausted, but I've been through medical training as an intern or resident, which, you know, is exhaustion. That's real exhaustion.
Well, Dr. Fauci, we can't thank you enough for making the time to join us today. For those watching, please follow Bloomberg QuickTake wherever you get your news on social media. And thank you so much again, Dr. Fauci, for your time.
Thank you for having me. Appreciate it.